All right. Hello. Happy Tuesday to everyone. Thank you everyone for being here. We have a special presentation today as part of our lunch program. Our UCONN students, our UCONN nursing students who have been here in and out since August are here to present on some of what they have been studying over this past semester. And I just want to say that when you guys are done here, you guys are like about to graduate, right? Awesome. So congratulations to you all.
Thank you.
Yes, congrats. And thank you so much for spending your time with us since August. It's been a pleasure having you all here, and we look forward to hearing what you have to present today. We're going to do 2 sessions. One is fall prevention, and the other is medication management. So we ask that while you eat lunch with us today, turn your attention to our UCONN nursing students and enjoy the content. Thank you again.
Okay.
You don't have to use it, and I can turn it up too. If you
Can you all hear me?
Yes.
Yes? Okay. So good morning everyone. Thank you for joining us. My name is Rose and I'm presenting with my classmates Thais, Maggie, and Ariana. We're going to be discussing falls and ways that we can lower the chances of falling as we age. According to Healthy People 2030, there are over 100,000 emergency department visits each year, and of those 100,000, over 6,000 are due to falls. And 1 in every 5 falls causes a serious injury, such as a broken bone or a head injury. It is recommended that adults over the age of 65 be screened annually for a history of falls or balance impairment. But according to another article we found, only 34% of adults are actually screened. According to the Connecticut Department of Public Health, falls are the leading cause of fatal and non-fatal injuries for older adults. Unfortunately, one of the risk factors for falls is age. This may be due to overall weakness, increased difficulty with walking and balance, postural hypertension, worsening vision, medications, hazards, but most often are a result of a combination of risk factors. As I mentioned before, age is a risk factor for falling. We have all had the chance to mingle and get to know a lot of you, and we all know that you are active within the Windsor Senior Center. Whether it be participating in pickleball, using the gym, or any of the other activities that are offered here. Staying active in this community is a great way to maintain a healthy activity level. In the following slides, my classmates will discuss what you can expect during a fall risk assessment and things you can start to do today to prevent falls.
Okay, so the educational topic is fall prevention in the older adult population, which is 65 and up. We're going to teach the risks of falling and strategies to reduce the risks. Some of the topics that I'm going to focus on are the factors that increase the risk of falls, which is mobility problems, balance disorders, chronic illnesses, impaired vision, and mental disorders like Alzheimer's. Some of the strategies to reduce the falls are daily exercising for strength and balance, taking vitamin D to strengthen the bones, get vision checks by eye doctors every year, and review your home.
It's just really hard to hear back here.
Oh, sorry.
Thank you.
Can you hear me now?
Yes.
Okay.
Much better.
And then some of the medications that one takes also can impact your own safety and increase the risk of falls. Some of the high-risk medications are sedatives, antidepressants, opiates, diuretics, and also beta blockers. So could we have our volunteer?
Josie.
Yeah. You're gonna fill out a fall risk assessment tool.
Okay.
Here, we'll put the chair here. I can see it.
You want to move it around? Yeah.
So you can go to the next slide. It'll show. Okay, so here. So essentially what she's filling out is a fall risk assessment tool that we got from John Hopkins. So the first part is going to ask, so what puts you at like a high fall risk is if you have a history of more than one fall within 6 months before being admitted. If the patient has experienced a fall during like a hospitalization, or if the patient is deemed high risk fall per protocol, so like seizure precautions or any of that. So if none, okay.
Amazing.
That's great.
What puts someone at low risk is complete paralysis or completely immobilized, but obviously that's not the case. So then we go down to the bottom, the second part, and it'll ask your age. So if you're 60 to 69 years old, that's 1 point. If you're 70, 79 years, that's 2. And if you're greater or equal to 80, that's 3.
Okay. 3.
Okay, so then you would put 3 points over there. Yep. And then the fall history. So have you had one fall within 6 months?
Before admission?
Yeah. So have you had like one fall within the past 6 months? No? Okay, so that would be 0.
No.
No points for you.
And then if you have incontinence, that's 2 points. Urgency or frequency, that's 2. Or both, that's 4. None?
We also have none,
So
yeah.
that's 0.
So that's, yes. And then the medications, which I stated earlier, which are opiates, anticonvulsants, antihypertensives, diuretics, hypnotics, laxatives, sedatives. So if you have one of these drugs, if you have 2 or more, that's 5 points. If you have a sedated procedure within the last 24 hours, that's 7.
I have
Yeah, I'll be right over here.
2.
Yeah.
So that'd be 5 points.
Is that against me?
Not necessarily.
Okay. And then if you have any, you don't have any of these equipment, so that'd be 0.
0?
Yes. And then mobility. So if you require assistance or supervision or transfer or ambulation, that's 2. Unsafe gait is 2. Vision or auditory impairment affecting mobility is also 2.
The visual, if I need eyeglasses,
Yeah.
2 points.
It's okay.
No, it's okay. And then cognition. So if you have altered awareness of immediate physical environment, that's 1. If you're impulsive, that's 2. Lack of understanding of one's physical and cognitive limitations, that's 4. Okay, so that'd be 0. So after you go through this, you'll count up your points. We won't say your points, but you'll count up your total points. And if you have 6 to 13 total points, that's a moderate fall risk. And if you have greater than 13, then you're at a high fall risk. So this is just an easy way to assess whether you are at a high risk or not.
Thank you, Josie.
Okay.
You can take
You
it
did
if you
great.
want.
Yes.
Okay, bye.
So some suggested interventions to implement in the home to prevent falls. Secure loose rugs with double face tape. Remove boxes, newspapers, electrical cords, and phone cords out of walkways. Move coffee tables, magazine racks, and plant stands from high traffic areas. Use handrails, grab bars, and raised toilet devices for assistance with balance, and also if you use any kind of assistive devices to move around. Also want to make sure that's in reach and that you can use it to mobilize. And then knowing the side effects of medications that are being taken, even if it's over-the-counter medication, it's recommended that you bring it into your primary care provider to have them help you understand the side effects of those over-the-counter meds and if it's going to cause any kind of interaction with meds that you're already prescribed and taking. Some of the proposed changes that we suggested to implement here at the Senior Center is to post like posters around the senior center with fall prevention information, group classes to talk about fall risks, closed circuit information like that can be played on the television here, like even during lunch, and offering like a monthly fall prevention screen just to assess the risk of fall and how often that changes per person, so that they can take the necessary steps that's needed to help prevent any kind of fall risk.
So with the information we provided you with, we were curious as to see on those flashcards I handed out, if you can, as many fall risk hazards that you can see in this fall risk escape room. So if you want to take a minute or two just to jot down the number of risks that you can see in this image that might put you at a higher chance of falling, and then we can discuss them and kind of troubleshoot some options so that we can fix home environments that cause risk. Okay.
Sorry.
So for our classmates, how many did you guys find? 7?
Whoa.
7? Okay, did anyone find more than 7? No. Okay. So there are 8 hazards listed in this image. So to start off, the poor lighting. So it's important that areas that you're walking have adequate lighting. So an easy way to fix this is just to point the lights towards areas that you're walking, so we're illuminating our walkways rather than the walls. Our second is the spill. So an easy way is just making sure we're cleaning the spills up immediately after they occur. Don't leave it and say you're going to come back to it later, because that poses a risk for yourself in forgetting, and it poses a threat to others who are in the same environment as you. The third one is this low chair. It makes it very difficult, especially if you're using an assisted walking device, to transfer from the device to a low seat. So making sure that the seats are elevated to a good height that's beneficial for yourself is very important. The blanket being on the ground poses a tripping hazard, so it's important to make sure that we're not creating hazards. Sometimes we just throw things and forget about it, and we don't realize that that's creating a hazard for us in the future. A lot of us have small pets, and pets typically like to be near you. A hazard can be your pet being too close to your feet and you not realizing they're there. So making sure we're always conscientious of our surroundings is very important. On this blanket right here, we have a lot of clutter, so keeping our environments clutter-free, organized is very important as well. The throw rug poses a threat because there's oftentimes a lip, so one of the techniques that Thais went over was using tape to tape it down to try to keep it very consistent with the other ground underneath it. And then the cord extension cords pose a really great hazard, so a good way to fix them is trying to keep them so they're tucked around the baseboards of the floor, if at all possible. We're going to play a video that kind of sums up our presentation and hits the key points that we think will be a good take-home message for everybody.
Hey, be careful. You might think you're never going to fall, but we all know someone who has, don't we? Next time, it could be you. The good news is most falls are preventable. Start with 6 easy steps. First, find a balance or exercise program to help you build stability, strength, and flexibility. Make it fun and go with a friend. Don't be afraid to tell your doctor if you've had a fall or are afraid of falling. Ask her to assess your risk of falling. Discuss medications with your pharmacist or doctor. They'll know what prescriptions and over-the-counter medications can increase your risk of falling. Make sure you get your vision and hearing checked every year, because your eyes and ears are key to keeping you on your feet. Keep your home safe. For example, remove any items you might trip over. Make sure your home is well lit. Use bath mats in your shower and install grab bars in the bathroom. And finally, remember, It's important to talk to your family. Ask for their support in taking these simple steps to stay safe. Falls are not a normal part of aging, but every 13 seconds, an older adult visits an emergency room for a fall-related injury. Luckily, you can take steps to reduce your risk. Visit ncoa.org/falls prevention to learn more.
So all in all, we hope everyone here was able to learn a little bit so that you can take this home. We do realize that the Senior Center is a great environment that promotes a safe environment. We have the automatic doors here, the ramps, the hand railings, and it's very important to take advantage of the opportunities offered here by using the gym and participating in classes and activities, and staying active is your best way to reduce risks of falls. Does anyone have any questions? Awesome. Thank you.
Thank you.